Primary care and preventative medicine, to me, and how we provide it or implement it on a day-to-day basis, is basically we are keeping people healthy.
Disease affects all of us, and eventually, old age catches up, our lifestyle choices catch up with us, and for us to catch them before they become an issue, it's essential for people to see their primary care doctors and get preventative health checks.
Usually patients, when they walk in, they're not, for those preventative visits, they're not acutely sick. So they might not think, hey, I should go to the doctor today. It's a good reminder to make sure that even when you're feeling healthy, if you haven't done your yearly physical, just to get it done and get your routine blood work done, because maybe we've seen a slight increase in your cholesterol, and if we catch it then, perhaps lifestyle changes, maybe some diet modification.
So there's one patient that sticks out in particular. He was a gentleman that we diagnosed with diabetes. He was deathly afraid of needles. He did not want to poke himself multiple times a day to check his sugars. So I came up with a solution where I offered him the option of doing continuous glucose monitoring, which is basically a device that you plug in to your arm, and it stays on your arm and it monitors your blood sugar 24 hours for 2 weeks, and it's just on you, so you're not having to poke yourself continuously. And so this was a great option for him. He was delighted to be able to do this, and he did really well. He ended up identifying foods that triggered his blood sugars to go up, and what to avoid. His blood sugars came down tremendously. He made really good decisions based on that, and so it was really satisfying to see that, and he was really grateful and relieved that he could get over that hurdle based on something that we helped him with.
We are preventing them from going into a state to where they don't want to be. Basically, we're keeping them out of the hospital.
We have a lot of ways employees can book appointments. They can pre-book online, or they can always call the clinic. We also have a secure messaging app, so they can essentially text message us. It's all private, and we can put them on the schedule, so they can expect to be seen relatively quickly, same day, if not the next day.
So that's, it's very hard to find that in any traditional clinic setting. And then our appointments are for a longer amount of time than traditional, appointments are scheduled in a clinic. And so again, that gives us more time to spend with the patient, where we can get to know the patient, know their concerns, and also educate them.
Depending on your insurance type, most patients don't have to have a copay, but depending on your insurance, it could be a small minimum fee, if any at all, for any services that we provide.
This place is so easy and it's so accessible by everyone that you have nothing to lose by coming and seeing us, because if anything, maybe you'll love it.
You don't have to skip a day of work to see a specialist for half a day. You can stay right in the office. You can come down, get your yearly physical done in about 40 minutes or longer.
Basically, we're a one-stop shop for all your healthcare needs. You can come down and get a physical. You can come down and get your labs drawn. Even if it's not by our provider, you can come down and get outside labs drawn. You can have a cervical screening. You can be referred out for your mammo. If your mammo is overdue in the next 2 years, we can send you out for a referral. If you're not feeling well, you need a Z-Pack, any medications, we have management for that. Or if you just want to talk to the nurse about diet control, weight loss management, we do an array of services here. That's why I call it like the one-stop shop for everything.